My name is Nurse Matt, and I'm going to do your full body examination today. Okay, perfect. Well, before we begin, I'm just going to let you know that the doctor agreed to let you out of the hospital today, but we do need to make a head-to-toe assessment. So let's go ahead and verify your first and last name and your date of birth. Okay. And do you have any allergies? Okay. Alright. Do you remember what you had for breakfast? French toast. Okay. So you say pain is subsiding. Okay. That's about a 2 out of 10. Good. Can you please show me exactly where it is located? Over here on the chest. Okay. Okay. All right. So I'm going to go ahead and take your vital signs. Okay. This will go on your index finger. Go ahead and insert that in. Okay, so I'm just going to let this here. And I'm going to take your temperature. This will go inside your ear, okay? Okay, perfect. So I would say it's about 98.3 Fahrenheit, and your heart rate is also normal. Let's go ahead and check your pulse here. Perfect. Okay, let's go ahead and take your blood pressure. Okay, so you do have an IV in there, which we're going to remove before you are discharged. So I'm going to go ahead and take your blood pressure on this part. Just leave that there. And that there. And here. Okay. Okay, blood pressure is normal, so that's very good. The doctor will be very pleased to hear that. Okay, let's go ahead and put this back here. Okay, so blood pressure was 118/72. Your heart rate is not elevated anymore. I know that's what you came in with. And temperature is also normal. Okay, respiratory rate is 18. Perfect. Okay, I'm gonna go ahead and listen to your lungs. We want to make sure that you do not develop any pneumonia while you're here. That's why we had you do so many breathing exercises. So I'm going to go ahead and just put the stethoscope on your chest, okay? Okay. Go ahead and take a deep breath in and breathe out. Good. And the same thing. Again, take a deep breath in and breathe out. Perfect. Okay, I'm going to listen to the sides as well. So go ahead and take a deep breath in and breathe out. Good. And again, take a deep breath in and exhale. Okay, I'm going to have you turn a little bit and I'm going to listen to your back, okay? Okay, take a deep breath in and exhale. Good, and I'll listen to the other side as well. Okay, take a deep breath in and exhale. Excellent. Okay, sounds good. And I'm going to listen to your heart as well. Make sure that I'm not listening, hearing any extra sounds. Any palpitations with the chest pain? Okay. Okay, go ahead and relax. Good. 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 Okay, I'm going to listen with the bell now. Good. Good. Okay, perfect. S1 and S2. And with the normal limits, breathing sounds. Perfect. Okay, let's go ahead and check your pulses now. So I'm going to just go ahead and palpate your pulses here. Good. And is it okay if I compare? Okay. Pulses are strong and symmetric. I'm going to go ahead and check your pedal pulses as well. Okay. I'm going to check your capillary refill. Very good. Very good. Okay. I'm noticing a little bit of redness on your feet. Have you stepped on anything in the bathroom? Okay. And I'm going to go ahead and check your chest as well. So I'm just going to remove the blanket a little bit. Okay, so I'm looking at symmetry, breathing normal. Very good. I'm not noticing any scars. Any pain as I'm palpating? Okay. Good. Okay. So what I'm going to do is I will listen to your belly as well. Make sure that I'm hearing very normal bowel sounds. Okay, so just breathe normal for me, please. Good. Good. Okay. That's perfect. Okay. I'm going to percuss, so it's going to feel like a tapping on your abdomen. Okay, and is it okay if I gently palpate? All right, so what I'm gonna do is I'll just squeeze my hands in here. Any pain there? Good. Good. Okay. So no pain upon palpation. I'm not feeling any lumps. That's excellent. Okay, I'm going to go ahead and take a look at the scar. Make sure that it's healing properly, okay, after your surgery. Okay, margins are very well defined. No redness. No signs of infection. Very normal temperature around it. And it's getting smaller, so it looks like it's healing properly. Good. Okay, perfect. And is it okay if I palpate your lower abdomen? I just want to check for any lumps. Okay. Good. And on the other side. Good. Okay, perfect. Okay. Good. All right. And I'm going to go ahead and check your neck. Okay. Okay, so I'm just palpating for any lymph nodes. Okay. I'm not feeling anything swollen, which is great. Okay. Tracheus midline. I'm going to palpate above your clavicles. Good. Any pain? Great. Can you please swallow for me? Good. Perfect. And I'm going to check your head as well. Okay, very good. All right. I'm gonna go ahead and check your eyes. Any pain? Okay. Is the light bothering you at all? No. All right. So I'm gonna have you look at the light. Good. And keep on following the light with your eyes only. Don't move your head. Good. 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 Okay. Excellent. Wonderful. Okay. Can you please look right here? Good. Good. Now can you please look right here? Excellent. Okay. And now look the other way. Look here. Good. And now look here. Good. And now look here. Good. Okay. I'm going to go ahead and check your optic nerve. So go ahead and look straight behind me, right at the TV behind me, okay? Good. And I'm going to come very close to your eye. Just take a look. Okay. Good. I'm not seeing anything abnormal here. Everything looks very good. Perfect. All right, let's go ahead and check your other side. Okay. Optic nerve looks intact. I'm not seeing anything abnormal. No scratches on the retina. And it looks very healthy. Okay. Alright, let's go ahead and check your hearing in your ear canal. Any pain? No? Okay, so I'm going to go ahead and check inside of your ears. Go ahead and look that way for me, please. Good. Good. Just keep looking there. And do you see anything? No. Good. Okay. Ear canal is intact. No signs of any infection. Okay, let's go ahead and check your other side now. Good. Perfect. Okay, I'm going to check your hearing with a tuning fork, and I'm going to go ahead and make some vibration sounds, okay? Now, tell me when you don't hear it anymore, okay? Okay, so this is one. Now, good. And this is on the other side. Now, okay, good. Okay. All right, I'm gonna go ahead and check your sense of smell. And I'm going to put this very close to your nose, and I need you to take a deep breath in, okay? Go ahead and take a deep breath in and breathe out. Okay? And what does that smell like? Coffee, very good. Is it okay if I sit next to you? Okay, thank you. And I do have one more. Okay, go ahead and take a deep breath in and breathe out. Okay, good. So your sense of smell is intact. Now we're gonna go ahead and check your facial sensation. Have you noticed anything abnormal? No? Okay, so what I'm gonna do is I'll touch you with two different textures. One is going to feel sharp and the other one is going to feel dull. This is what sharp will feel like. No, this one is going to be sharp, and this is what dull will feel like. Okay, so go ahead and close your eyes and tell me if you feel sharp or dull. Sharp, dull, sharp, dull. Good. Keep your eyes closed. Dull, 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 sharp, dull, sharp, dull, and sharp. Good. What about here? Dull. Very good. So your facial sensations are within normal limits. That's very good. And what I'm going to do now is I'll check your taste. I will give you a few samples. We have them right here. They are definitely very basic, so don't worry about not being able to recognize them. Okay, and I'll put one drop on your tongue. Go ahead and tell me what it tastes like. It tastes like chocolate. Very good. Okay, so that's a very good start. Let's go ahead and try one more. Usually, if somebody has a neurological problem, then we would definitely find it out by the second trial. So let's make sure that we're mixing this one really well. Okay, good. And I'll put one drop on your tongue again. Good. That was a little bit more than one drop, I agree. It tastes like strawberries. Okay, excellent. Okay. Let's see what else we have to do. Well, I'm going to ask you a few questions, and I need you to just answer to the best of your abilities. I want to make sure that your neurological functions are also within normal limits. Can you please tell me today's date? And who's the current president of the United States? Good. And who's the president before him? Okay. Perfect. All right, so I'm going to have you draw a circle for me, please. Excellent. Thank you. Now go ahead and draw a triangle. Perfect. And can you please draw a square? Okay, perfect. Very good. Can you please tell me how many corners does the triangle have? 3. Good. And how many corners does the square have? 4. Very good. And can you please add those 2 together? 7. Perfect. Okay, so you remember what you had for breakfast. Your vital signs are within normal limits, and your incision is healing very properly. I'm not worried about that. I'm gonna go ahead and give you my okay to be discharged tonight, and the doctor will come in to give you the discharge instructions, but for sure I will let him know that everything was within normal limits. Do you have any questions for me? Yes, absolutely. So we're gonna go ahead and set up transportation for you, and we have 2 options. One is for us to call a cab for you, and 2 is to call a family member if you have that available. A family member. Okay. Okay. And oh right. Yes. 773-139. 4921. Perfect. So we're gonna go ahead and give them a call and make sure that they are available to pick you up, and we're going to arrange that for you. Perfect. All right, I'm going to let you rest now, and let me know if you need anything in the meanwhile, okay? All right. It was very nice to meet you. I'll see you back soon, okay?